Everyone, I would like to invite Professor Vaidya Vinita Deshmukh and Professor Vaidya Yogini Kulkarni as chair and co-chair of this session, respectively. I request them to kindly take their place on stage. Dr. Vinita Deshmukh is DSc, PhD, Deputy Director, ICTRC at Bharatiya Sanskrit Darshan Trust, Wagholi. She is specialized Ayurveda consultant, researcher in the field of cancer, AIDS, and delayed bone healing. She has international and national patents on her name, along with Dr. S.P. Deshmukh sir. Yes. Dr. Yogini Kulkarni, she is MD, PhD in Ayurveda. She has been practicing Ayurveda since last 36 years. She has 27 years teaching experience in subjects like Dravya Guna and others. More than 30 research papers and 2 books are published. Now, I will start the session now. I would like to call upon a stage our first speaker, Vaidya Gore. Vaidya Gore is MD in Sharir Kriya and PhD scholar affiliated with IRCTC, Bharatiya Sanskrit Darshan Trust, Wagholi, as a research associate. He is practicing Panchabhautik consultant and has 25 years of experience in practice. He was honorary consultant at Red Cross. He has visited many countries for propagation of Ayurveda and Panchabhautik Chikitsa. Now I will hand over the mic to him.
With the blessings of Guru Mauli and Datar Shastri, I will directly start for my lecture. Dr. Suru sir has given message to me to stick to your timing and cut it off and behave like a Kokanastha. At least learn from Datar Shastri that much. So I'll make it within 5 to 6 minutes and will start my lecture. I'm very happy to represent both institutions, that is Bharatiya Sanskrit Darshan Trust, founded by Sir Deshmukh Maharaj, and of course Chikitsa Kendra Sangli. So my responsibility is doubled. Whatever I have learned or observed and from Datar Shastri and Suru sir, Panchabhautik Chikitsa, and cancer treatment from Sir Deshmukh sir, I would like to share with you, but with my limitations. Next. We know cancer is a very difficult to treat. It is a multifactorial complex disease. Nowadays, patients are increasing of cancer. So it is our duty from Panchabhautik Vaidyas to treat or give some help to cancer patients. Definitely we can do it, but we have to need or evaluate patients and assess it properly. So how to assess cancer patients? I'll make it very short. It is not possible within 6 minutes to cover all the topic, but I'll try to make it very short. Already Dr. Aniruddha has made that how to assess any patient, that with Rogi Pariksha and Vyadhi Pariksha. How to do Rogi Pariksha for the cancer patient? Yes, from the modern point of view, current clinical condition is necessary to understand. For few cancer patients, their severity, we have to check that, whether cancer patient has severe condition. For that purpose, ECOG score and Kornowski score, all these scores and QLK assessment we should perform. But from the Panchabhautik point of view, examination of Agni Samstha Parikshan, already very detailed description told by Dr. Aniruddha. I am not going into details of it, but for the Vaidyasya Vaidyakatvam is to find out the exact deformity in the Agni Samstha, relying at least for the cancer patient, relying only on patient's symptoms and whatever he is feeling, it's not sufficient to assess the patient properly. So Agni Samstha Parikshan, its effects, we have to take it into consideration for the proper knowledge of the disease. Now from Vyadhi Pariksha point of view, I am not going into details, but it is important for the at least cancer patients to investigate timely and properly for the extent of the disease and prognosis and diagnosis of the disease exactly. Now with the Ayurvedic point of view, Nidana Panchak, Hetulinga, Aushadhi. Next. I have divided Hetus in a Ksharadharmi and Amladharmi Hetu. Already discussed this portion, this topic. It is not possible within few minutes to explain each and everything. Remember one thing, that Ksharadharmi Hetu and Amladharmi Hetu as Apa Mahabhut dominant and Ksharadharmi Tej is Teja Mahabhut dominant. We have to remember that most of these are dosha prakopak hetus and not directly Vaidya hetus. We can include chemotherapy as a Ksharadharmi hetu. Next. Now it is necessary to understand the symptoms of the disease, because cancer is different type of disease. Anukta Vyadhi, we have to look at for it. For cancer patients, we generally see four types of symptoms. One is tumor related, another one is metastasis related, then treatment related, and lastly generalized symptoms. We have to look whether patient is coming after the surgery or in between the chemo and radiation. For that purpose, we need to evaluate the exact symptoms. From the Ayurvedic point of view, though cancer is Anukta Vyadhi, we can compare few of them with our point of view. We can see similar conditions like for non-solid tumors, that is blood tumor, Pandu, Raktapitta Jwara, Jirana Jwara, Raktadhatu Gata Jwara, all these we can compare with. And other directly, Vrana, Granthi, Arbuda, Shotha can compare with the Arbuda. Along with it, some GI tract related cancers we can compare, or some hepatobiliary cancers we can compare it with Kamala, Kumbha Kamala, Halimaka, etc. with Grahani and Udara also. Next. Now I have compared with this Mahabhut dominance, that Prithvi dominant can convert, we can see the symptoms like Granthi, Aurat, Shot, etc. Aap Mahabhuts, Dravata and Saratva can lead to Abhishandan, Srava, Teja, Pak and Vaivaranya, and other you can see. Next. Now, what are the Samprapti Ghataka? All we know that Rasa Rakta and Mausa Dhatu are definitely involved. Shukra Dhatu's function is Nava-Nirmiti. In cancer patients, Nava-Nirmiti is hampered, so definitely Shukra Dhatu is involved. Next is Oja. In later stage of the cancer, Oja Dishti Lakshana along with Oja Dushti Hetu can be seen. So Oja is also, and Agni and Dhatu clearly we can see. Important is mind involvement, manasik cause. Cancer is a disease of irritation of the body as well as irritation of the mind. Manakshobha, already mentioned by Dr. Jagtap Madam, related with mind. Whenever there is a Shadripu, the involvement of mind we have to consider. In our clinic with Dr. Deshmukh, we always observe that sudden shock can lead to cancer, or trigger factor can become trigger factor for the cancer. Next. Now these, in the later stages, cancer is a very complex disease. It may lead to the complexity, so may lead to the avasthas, different avasthas, dhatu gata avastha and dhatu pak avastha. I have mentioned with the Teja Vayu for the dhatu pak avastha can compare with the inflammation and necrosis, and Vayu and Akash, dhatu gata avastha with metastasis. And mention here Sroto Dushti Lakshanas for comparison of the cancer with the Panchamahabhuta. I am not going into details of it. Next. Now, important part is aims of the treatment. Yes, regression of tumor size and metastasis should be our aim, but it seems to be difficult, at least right now. But it doesn't matter. Next is prevent and minimize side effects of the conventional treatment. Yes, we have number of cases, number of publications. that proves that our treatment can be helpful definitely to improvement or to reduce side effects of the conventional treatment. If we can achieve that, because sometimes conventional treatment like chemo and radiation patient is taking for to reduce the tumor size cannot complete treatment. So because of the target of reducing the tumor size cannot be achieved, in that case our treatment is definitely beneficial. To improve quality of life, yes, day-to-day complaints we can reduce of the patient with minimum side effects. That can be achieved, and prolong and prevent recurrence. We have number of cases. Some cancers tend to recur at early stage or within few months or within few years, like a triple negative breast cancer. We have number of cases that we have achieved for the prolong of the recurrence in them. So we can achieve. Next, plan of treatment. What should be the plan of treatment? Before going, nowadays there is a trend to use herbal extracts of the different type of herbs to cure or to use it in a cancer patients. Right from Shatavari, Ashwagandha to famous Guduchi and Amla-Kshar. To use its anti-angiogenesis effect, antioxidant effect, and so many anti-inflammatory effect or chemo or cytoprotective effect. But that is not a complete treatment. It is Vyadhi Viparit, or we can say Lakshana Viparit treatment. It is not a complete and proper line of treatment to take care of cancer patients. So what should be the line of treatment? As Datar Shastri has mentioned, Chikitsa should be Mulagami. So Mulagami Chikitsa to reduce effects on the Agni Samstha, Yakrut Pliha and Mutrapinda, as well as Garbhashaya in female. So correcting Agni Samstha, then one lecturer has mentioned that it is our medicines acts like a Sukshma Shodhan. Cancer patients is not arha for the Shodhan in general. So in that cases, Sukshma Shodhan Aushadhi can be helpful. So after correcting the Agni Samstha, Dhatvagni Deepan should be performed. Datar Shastri has used many Dhatvagni Deepak Kashayas right from Patoladi, Chaturthak, Panchakashaya, etc. So we have to use that later. Then for the Bala Rakshan of the patient, we have to use Rasayan and Vedic Shamatva Vardhan treatment. For the cancer patient, treatment is prolonged. So some Lakshanas can occur. For to arrest that, Lakshana Viparit Chikitsa can be done. And Buddhendriya Chikitsa, it is important because of mind involvement is there. So Buddhendriya Chikitsa, he has mentioned Jatamausi and Saraswatarishta. I am not going into details of it. And diet and lifestyle related topic has been covered in the morning session. Next. This is, in general, Panchabhautik Parivar medicines we use. Ananta Manjishtha, Ksharadharmi and Amladharmi combination, Punarnava, Punarnaveti Punarnava. Yes, we need regeneration of the cells in the cancer patients. So we have to use Punarnava also. Laksha will act on Rakta Dhatu. Padmakashtha, mentioned by Wali sir, will act on Prithvi Dhatu. And for the Asthi improvement, Haralu, Ksharadharmi, Mutrala, Varadhara. Varadhara is important. If we look at the Falashruti of Varadhara, it has mentioned Shukra, Ayu, Bala, Vardhana, Swara, Kanti, Rasayana and Vrusha also. What else you want for the cancer patients? और क्या चाहिए? सब उसमें है. लेकिन we have to select the proper timing for the patient to use this type of medicines. Already, next, Apamarga, Mundi, Kanchana and Shigru, all are the Ksharadharmi Dravyas mentioned by Dr. Lad Madam just now. Yes, Kanchana are well known. We generally used it in Urdhva-Jatrugat nodal involvement or thyroid cancers. Shigru, Gamitva is Yakrut, so you can use it in a hepatocellular carcinoma. You may feel like it is a nuskebaji for this cancer. You can use these medicines but for the beginners, it is necessary to use these combinations and time-tested combinations so that they can achieve their goal or for the continuation of the patient's relief. All this Phala and Lagu Suchikar Rayo has been mentioned by the previous lecturers. Amalaki Taila and Haridra Taila for the Raktagata Ushnata as well as Asthimajjagata and Shukragata Ushnata we generally use to reduce Ksharadharmi Tej. Now Bhasma, Raupya, Amladharmi, Suvarna, we have to use it for the Rasayan purpose and Balya purpose. I have not mentioned one famous Bhasma here. Okay, just 1 minute. Uh, Rasakalpa and Suvarnakalpa we have to use for the as a Vyadhi Pratyanik or Lakshana Viparit Chikitsa. Next. Only I will discuss with the one case and then I'll stop. This case of a male patient, age at diagnosis 75 years. Diagnosis was adenocarcinoma of prostate in June 2017. Surgery done after that immediately 2017 and was on androgenic deprivation therapy, but unfortunately developed bone metastasis in November 2020. Main complaint of that patient was Katishul, difficulties in movement, Malavashtamba, Daurbalya. So I have started Ayurvedic medicines in September 2020. In observation, Yakrut Ghanata was observed, both Vrukka Sparsha Sattva. So considering the Yakrut Ghanata and Vrukka involvement, started with the Shwa, and for the severity of the patient, started with the AV, Arogyavardhini, and for the Balya and Rasayan purpose, Suvarnamalini Vasanta was used, and then Panchakashaya for the Asthi Dhatu Agni Bala, and then Padmakitta was given for the to give Bala to Padmakitta. And few medicines, Panchakashaya, Lakshadi Google, Trayadoshanga Google, etc. for used for the reduction of the Lakshanas. The treatment is almost for or nearly 3 years. And what was the outcome? Improved quality of life, no further metastasis has been developed, and achieved symptomatic relief. All reports are available, and latest PSA value is within normal limit. So I think I will stop here. Thank you for giving me an opportunity. Dhanyavad.
Thank you very much, sir. This was really very knowledgeable, very wonderful lecture. And I request our chairperson and co-chairperson to felicitate Dr. Samir Gore, sir. There is a small announcement over here. All the speakers and the panelists are requested to meet Dr. Mandar Akkalkotkar, sir, before they leave the campus. Thank you.
Hello and namaste to all the respected Vaidya, all the respected delegates, all the Ayurvedic students, and all of my friends. My name is Vaidya Abhijit Shinde, and I'm connecting to you from London. I'm practicing in London since 2009, and I'm trying my level best to explore Ayurveda and understand the Ayurveda and helping the community over here with the help of Ayurveda. So today, without taking a long time, I'm going to explain to you, or rather than that, I'm going to share with you my experience with the Panchabhautik Chikitsa. So in 2016, I completed the diploma in Ayurvedic Panchabhautik Chikitsa from the Sanstha in Sangli. I completed that online because of the distance. I couldn't manage to come there and get it done. But after completing this course, I was introduced to the number of basic principles of the Panchabhautik Chikitsa. Initially, my approach was just the theoretical, as usual, as we study into the BMS. But when I started using the Panchabhautik, compositions, I was mesmerized and I was so confident to use those on my patients over here. And that's what I'm going to share with you today. So without taking a long time, let's just jump to the two classical cases which I have choose today to share with you. and how this Panchabhautik Chikitsa was helpful to me. I'm still exploring that, I'm still enjoying it, but I would like to share these two classical cases with you. So my first case was a 43 years female, and she came to me, she was the Asian background, she was Indian origin female. She came to me with a very typical and interesting symptom about the floaters in her eyes. So she was complaining like she continuously sees the dots in front of her eyes, and this complaint was with her for the last 20 years. She approached the NHS, which is National Health Services in UK, and she was referred from general practitioner to the consultants, and from the one consultant to the another consultant, but no one was able to pinpoint what exactly was happening with her. Everywhere she was offered the like steroidal drops. Everywhere she was offered the promises like it will settle down, but nobody was giving her any good answer for her problem. And 20 years she was lingering around. When she came to us, I started doing the case study, and with that case study I found the following symptoms and following complaints. So she was complaining about the floaters, black dots in front of her eyes, since last 20 years. She was complaining about the joint pain and stiffness into the multiple joints. And also, the interesting fact she told me is that her visual blurring is associated with the pain episodes in her joints. Uh, because I studied the Panchabhautik Chikitsa, by this time I was able to diagnose the Prakriti as Amla Prakriti and Kshar Prakriti. So I diagnosed her Prakriti as Amla Dharmi Prakriti based on her date of birth, as we all know how to do that. Datar Shastriji blessed us with all this. So I diagnosed her as Amla Dharmi, and while taking the history with her, I found like in her daily consumption she was eating the pickle, lemon, tomato. She was eating the yogurt a lot. So yogurt a lot. So basically this is all the amla dominant diet she was taking. Also on top of that, she gave me the history of the chicken pox in her childhood, and she did mention it was a severe chicken pox. Based on that, I started, based on this history, I started immediately like thinking about the Amla-Kshar Siddhanta. And I will quickly jump onto the medication because because of the lack of time. That I started using the Bruhat Vasakadi Kashai, I started using the Saptamrut Loha, I started using the Apamarga Kshar, on which I'm going to explain quickly, and I started using the Amrut Mustadi Kashai. So because Amla Dharma was increased, I wanted to use the Kshar Dharmi. That's Kshar Dharmi, some herbs. That's why I used the actually Apamarga Kshar. And Amrut Mustadi Kashai, as we all know, is the Asti Majja Pachak. And we know the eyes are made up of the Majja. So I wanted to work onto the Majja Dhatu. I diagnosed that her Pitta, that means her Pitta Dhara Kala was disturbed because of the Pitta, because of the Amla Dharmi. So Ya Eva Pitta Dhara Kala, Sa Eva Majja Dhara Kala, we all know that. Based on that, I choose this number of herbs and I administered that. To my surprise, within the 2 weeks time, her floaters, her dots, they were 60 to 70% better, for which she was struggling for the last 20, almost like 20 years. And I continued the same herbs for the another 3 to 4 months, and she was completely relieved. So that was my first case. I'm sorry, I'm just going a little bit fast because of the lack of time. I will jump on to my second case. The second case was diagnosed as the granuloma annulari. Now, this is the skin condition which was diagnosed by the dermatologist, in which a patient does show the ring-like skin lesions. She was showing the burning, and she was showing the irritation as well onto the skin. This lady was 70 years old lady, a factory worker, and she came with this ready diagnosis. Of course, I did not work on her diagnosis. So according to the Panchabhautik Chikitsa, again, principles, I started taking the case history. And I found this time that her Prakriti is a Kshar Dharmi Prakriti. Again, when I took the history, I found like she was giving me the, a history of multiple miscarriages. She was giving me the history of severe chickenpox and the shingles. For the herpes, we call here shingles, and she had that twice. So that was more than sufficient for me to understand and utilize the Amla-Kshar Siddhanta over here. Associated with that, she was giving so many other episodes. For example, multiple episodes of the malaria, hay fever, asthma. She was diabetic, and she was the patient of the angina along with the high blood pressure as well. So based on this information, again, I, in my head quickly came is the Amla-Kshar Siddhanta. I understood that Ksharadharmi Ushnata is increased and I need to use something Amladharmi herbs over there. So without hesitation, I started using the Paripatadikada and the Rajni Yoga. Before that, when I did the Udar Pariksha, when I did the abdominal examination, I found that the Yakrut Sparsha Sattva was there and there was the Ghananad onto the Yakrut. So I used the Falatrikadi and I used the Paripatadikada Rajni Yoga along with the Falatrikadi, and I used typically Champakadi Agad. Because Champakadi Agad, reason to use that was she was giving me the history of multiple episodes of the malaria. This principle I learned from my guru Vaidya Samir Jamadagni, that whenever we get the history of any bites of any Kitak Dansha, then we should use the Agad. And so many times we find the correlation that the Dansha which was done previously can impact now. And I used the Paripatadikada, Rajni Yoga, Champakadiyagad, and Falatrikadi along with the Lagumanjishtadikada. Again, the same thing happened, and that within the 2 weeks' time, all of her rashes, all of her lesions, with the irritation, with the burning, they started slowing down within 2 weeks' time. So 60 to 70% relief she got within that 2 weeks' time. And I want to just summarize this quickly, that these two classical cases gave me the enough confidence to work with many patients. Since then I'm working with many patients using the Panchabhautik Chikitsa principles. I'm very thankful to Dr. Prashant Suru sir, who gave me the opportunity to share my experiences with you. I'm very thankful to Dr. Arvind Kulkarni as well, who is continuously supporting me to understand and explore the Panchabhautik Chikitsa very well. And none other than I'm very much thankful to our Atmaram Datar Shastriji, because he is the pioneer of this Panchabhautik Chikitsa and he introduced the world with this Panchabhautik Chikitsa, which is just gives the mesmerizing and unbelievable results. So thank you very much for all of you for listening me and giving me the opportunity to share these experiences. I'm very sorry I may have gone a little bit fast due to the lack of time, but I wanted to share my gratitude. I wanted to pay my sincere thanks to Datar Shastriji and everyone who is involved in spreading the Panchabhautik Chikitsa all over the world. Thank you very much and all the best to everyone. Thank you.
Now, our next speaker is Vaidya Radhika Deshpande. She is BAMS, MS Psychology with Diploma in Panchabhautik Chikitsa. She has specialized in Vidyakarma and Agni Karma, which she has learned from Dr. Neetu Kala Madam. Her topic is Conceptual Study in Spine Disorders and Panchabhautik Concepts. Over to you, ma'am.
Hello everyone. So I was supposed to talk up to 15 minutes, but now time is restricted for the 7 to 8 minutes. So सगळ्यात प्रथम आपणच्या चरणी साष्टांग नमस्कार. So when we say about the spine or spine disorders, depending on our area, it might have any abnormalities or disorders. There are few conditions. So in different areas might be cervical, lumbar, thoracic, sacral, coccyx. So the common symptoms are the pain, numbness, tingling sensation, restricted movements, stiffness, swelling, discoloration, lump and hump in the specific area of the spine. To understand the problem, we go through the pathological and radiological investigations. So according to Ayurveda, we do 3 types of investigations. One is Darshana, Sparshana and Prashna. So most of the time we understand all the hetus, all the deformities within these 3 pariksha. In spine disorders, hetus are very less of aharaj. Most of the time those are viharaj, abhighataj, aghataj, and sometimes associated symptoms of other diseases. So improper postures, wrong habits, occupational or professional disorders leads to spine disorders. When you say about the Samanya Samprapti, the main culprit is the Vata only. And Hetu Sevana, Vata will get disturbed about two types. One is Santarpanjanya and Apatarpanjanya. But in both conditions, Vata gets Dushta. And when it is in young age, Mausa and Snayu are affected with the Vata and creates Margavarodha. And in old age, Meda and Asti Dhatu gets affected and creates Apatarpana with Kshayatmak Samprapti. As we don't have any screws, bolts to fix all the joints, those are attached with each other with the Mausa, Snayu, Sira, Kandara. So any pull and push or stretching in this area will lead to the spine disorders. So most of the spine problems are having the acute samprapti or acute onset because of different causes. And most of the time those are postural only, and which creates the Margavarodha. So when we go through the Samanya Chikitsa Sutra, so Margavarodha we use Kashayas. And sometimes if it is having Amata, Samata, we go through the Pachana Aushadhis. So different local Sthanik Bastis are used, Panchakarmas are used as a Vaman, Virechan, Raktamokshan. So depending on that condition. But we are as South Indian, we use most of the Svedanas, kiddies, and we use chakra therapy, marma therapy, varma therapy, manipulation therapy, chiropractic. And especially I do different lepas, Sthanik lepas. Those are Prushta lepa, Lal lepa. Actually, Prushta bandhani is also done, but I never use. I use Lal lep instead of Prushta bandhani. So in Samavastha, some Pachanaushidis or Google Kalpas are given. So if the BMD is less, we give Tiktakshirabasti, calcium support, and as well Asti Majja Pachak, Lakshadi Gugul, some gold medicines are given. So kalpas like Trayodashang Gugul, Kaishor Gugul, Panchatikta Gugul are also given. So Samanaushidis like Sinhanath Gugul, Mahayogaraj Gugul, Punarnava Gugul are given. So sometimes if the Ruja is more, Tivrata is more, so we give Vata Gajankusha Rasa, Mahavata Vidvamsa Rasa or Brihat Vata Chintamani. So different oils, different massage and different technique of the massage are also used. If the few patent medicines also we use like Lambatone, Servilon, Kshirabala, Palsineuron, so or Muscle Fort. But today we are here to listen about the Panchabhautik Chikitsa of the spinal disorder. So when we look after the spine looks like a curve shape. Means it is like a wave. So it is not a straight. As it is a wave, the wave is like a water wave, which indicates the Apa Mahabhuta. So Vayu Prerane Saraha. So in spine disorders, mainly Vayu and Apa Mahabhuta, those both get disturbed. Means their gunas might be increased or sometimes decreased. If one guna is increasing, the other is decreasing. So after Hetu Sevana, Vayu's Rukshadi guna increases and Apa Mahabhut decreases. So when Vayu increases, the pain, dryness, stiffness increases, and reversely, Apakshaya happens. Then lubrication between the two vertebrae that reduces, which creates a gap into two vertebrae, and that gets the nerve root get compressed. It leads to desiccation of the disc, further which can lead to bulge, herniation, and if the hetus is severe, it can lead to desiccation of the disc also. At Rukshata and Kharatva increases, then the Snigdhatva, Apatva, Dravatva, Mrudutva decreases, which can lead to the vertebral stenosis, lordosis, kyphosis, and sometimes vertebral fusion can also happen. And sometimes it also leads to the stiffness in the Mansadhatu also. As Apatarphanottak Samprapti, Vayu, Akash, and Tej Mahabhuta are involved. In Margavarodhatva, Apa and Prithvi Mahabhuta are involved. Those are increased. So, Avkash of the Akash that decreases and Vayu Gati increases in it. So, which can lead to the severe pain. So, patient complains that that it is a pinching pain. चुभी जैसी वेदना होती है, दर्द होता है, ऐसा लगता है कि कहीं अंदर से चुभ रहा है. So that time it happens with the margavarodha. So pain is acute and severe. But when patient come to us in this severe condition, first of all, rather going through the other medications, we do Viddha karma and Agni karma. That releases the margavarodha and that releases the vayu there. And if it is more and patient is not able to sit, we do Viddhagni karma with the Viddhagni machine, and then I go for Lal Lepa, and next to it I go for the medicinal treatment. So again, next is the spine comes under the Vyanavayu sthana. So Udanavayu sthana. So Udanavayu Vikriti affects the spine and vice versa. Vertebrae are attached with each other with a mouse, snayu, kandara, sira, means mouse, meda, asti, majja, their srotasas, their mulasthanas get affected. Mulasthanas of this meda, asti, majja, avahasrotas are vrukka, and vrukka lies in Apana-Kshar. So we have to see the Agni and Agni Samstha as well. Apan Vayu gets the Pratilom Gati and makes Vyana Samana Vayu Dushti. So key points to here, according to Panchabhautik, expect for all spine disorders, first Agni Samstha should be examined by the Udar Parikshan. Specifically, Samana, Apana, Vyana Vayu should be treated. Mausa, Meda, Asti, Majja, their srotasas, Mulasthanas, Mala should be observed and treated accordingly. For planning Panchabhautik Kalpas, Vyadhis and Hetus, Amlata and Ksharata should be considered and treated accordingly. So the Kalpas which we use, the first choice of Kalpa is the Shva. So it works both on Mutrapinda as well as Apamhabhut. Varagugul, it's a Balya and Rasayan. Kanti Prabha and Padmakakitta, that gives the stability to the Maunsadhatu, and it works in the radiculopathy and neuropathy. Babul Niryas, this is the upper special find. So it acts as a sandhaniya for all the vertebral joints. So it gives the lubrication also. So Haldavanekare sir says that it is used in degenerative changes with a Paki, Shva, Shrunga Kitta, Panchasar, and used in the Vyanodankal. Harodi is also one of the choice of drug, as it is Mutral, Amapachak and Ksharadharmi. So it is used in the Mutrapinda, Pidana Sahatva, Mutrapinda, Shotha, etc. Tritiyak is a Mausapachak used in the Angamarda. Panchakashai, it is the Asti Majja Pachak. When the Samprapti is very deeper and up to Majja Dhatu, it is used with the Babul Niryas. Varanga-Kshar, as it is used in the Advashosh also. So if the Hetu is about the Advashos, it is used Rayo, Jingi, Jingi Shardi, Giri, Jata Maunsi, Shobhanjan, these all are used. Some local applications are also done, like a Mahasaindhavadi Tailam, Amalki Tailam, and Panchakashayla Tailam. Thank you so much.
Thank you very much, sir. Ma'am.
1 minute.
I request our chairman. I request our chairperson and co-chairperson to felicitate them.
त्यांना कन्क्लूड करायला सांगितलं. काही उल्लेख करके अभिजित शिंदेचा फक्त व्हिडिओ आम्ही दाखवलेला नाही, पुस्तकात पूर्ण लेख आहे असं बोला. अभिजित शिंदेचा
I request Dr. Co-chair and chairperson to conclude the session.
Thank you. Both the presentations was good. Gore sir and Deshpande madam also given a very nice presentation regarding the cancer and spondylosis, means spine disorders. So time is very less. So we will not spend much time to conclude. So thank you one and all.